Hi Duke Birthing Center staff, I'm Audrey with Lactation, and this is Nicole, and we're just going to review the lactation portion of the 2011 Skills Day. If an infant is stable immediately after birth, you should place the infant skin to skin or offer the infant to the breast. If the infant will not latch, keep the infant skin to skin. The goal is for the infant to breastfeed within 1 to 2 hours after birth when he or she is in their awake and alert state. During the first 24 hours of life, it is normal newborn behavior for the infant to be sleepy and inconsistent with breastfeeding. However, mothers should offer the baby to the breast at least every 3 hours or sooner if the baby is showing signs of hunger. Infants should feed at least 8 to 12 times in a 24-hour period. If the baby will not latch, put the baby skin to skin for 15 to 20 minutes and try latching again. If it has been 6 hours since the baby has fed, follow the Duke Birthing Center protocol for blood glucose checks. During the first 24 hours of life, the normal amount of colostrum is a few drops to 5 milliliters. During the second day of life, the normal colostrum amount is 5 to 15 milliliters, and during the third day, it's 15 to 30 milliliters, and after day 3, it should be a minimum of 30 milliliters. Typically, a mother's milk transitions in around 72 hours after delivery. Mothers should be encouraged to use either the football or the cross-lap hold when positioning the infant. It is the standard of care for the nurse to observe a full breastfeeding session at least once per shift, so that is 2 breastfeeding sessions in a 24-hour period.
If mother has sore nipples, make sure that the infant is positioned properly at breast level, ensure that the infant is latching far enough back onto the areola, and that the top and bottom lips are rolled outward. For sore nipples, flat or inverted nipples, or for breast engorgement, refer to the lactation notebook on the Duke intranet under policies. Nipple shields should not be used for flat or inverted nipples unless a mother has a measurable amount of colostrum or breast milk. A lactation consult should be ordered anytime any intervention such as an S&S or a nipple shield is introduced. Hydrogel dressings are preferred for sore nipples. If you choose to offer lanolin, do not combine it with the use of hydrogels. If there is a medical reason to supplement the breastfed infant with formula, the care nurse should initiate mother's pumping with the hospital-grade electric pump. Late preterm infants, 34 to 36 and 6/7 weeks, are potentially not consistent with breastfeeding and may need supplementation. Therefore, these mothers should be assisted with initiating pumping within 6 to 8 hours after delivery so that the mother can supplement with her own pumped colostrum or breast milk.
For medications incompatibility with breastfeeding, consult a lactation consultant and refer to Medications and Mother's Milk by Hill or the LacMed website. Also, the infant's pediatrician or lactation consultant can contact the Lactation Study Center during weekdays only. It's important to remember that magnesium sulfate is compatible with breastfeeding. Mothers should continue to pump and/or breastfeed and give colostrum while receiving MAG.
For our infants in the ICN, the mother should be asked what their feeding goal is prior to delivery if possible, so that early initiation of pumping can be started if mother's plan is to breastfeed. Evidence-based research supports the practice of initiating ICN mothers with electric breast pumping as soon as possible after delivery, within 6 to 8 hours, to elevate prolactin levels and encourage milk production. Pump setup and initiation should be completed by the mother's care nurse. ICN mothers should be instructed to pump every 3 hours or 8 times in a 24-hour period.
The Duke ICN has a colostrum protocol, and they give 0.1 milliliters of colostrum in each cheek every 4 hours for the first 5 days of life. This is important in promoting immune response and to protect the infant's gut. Early initiation of pumping and providing colostrum is important for the ICN PICNIC study, which is a study for extremely low birth weight infants. ICN mothers should be provided with 4 sets of colostrum bottles, which would be 8 colostrum bottles total. And Brittany Watson, Flora Delapaz, and Megan Cowles will be reviewing the use of the preemie mode for the Symphony pump. Thank you.